Yes. Hello, everyone there. It's a nice Friday again, and happy to be here with you and to speak about things about bariatric surgery. And today is a nice day. We have a guest, bariatric surgeon, Dr. Oleg Kozlovskis. Those from you who have been with us already in Sigulda Hospital, they know him very well. But those who are just preparing and getting ready, getting their questions ready and considering the surgery, so this is a good time to see the doctor and also to ask questions if you want to ask anything. So feel free to write down in comment section, so we will finalize the meeting with questions and answers. So today we are going to speak about criteria for bariatric surgery. And in the end, is the surgery for everyone? Of course, it's a serious question for your life to consider. So I will give a word to our surgeon. Hello, doctor.
Hello, Ilva. Hello, everybody. Thank you all for having me. And we can start with broadcast in Latvia. It's very nice winter, very white everything around, and a little bit coldy, -5 or 4 degrees. But children are very happy because winter is white. It's possible to do all winter activities. But today our activity is to decide about operation. It's not easy question. It's very complicated questions, and these questions have to be very, very taken seriously in account each person and also every doctor. So when I'm thinking about operations, I divide it in two big parts, answering on this question. And this big part will be like medical criteria, which mostly is dependent from your health condition, from surgeon's point of view on your medical health. And another criteria is personal criteria. So what you have to expect and what you have to know like a person about surgical possibility to treat obesity. So I would like to start with medical criteria, and there are quite a few strong medical recommendations when we can do bariatric procedure, when bariatric procedure is contraindicated. And I would like to start with most common things what we are looking on. It's a BMI. So you have to count your BMI, and we every patient who is coming in our hospital, we make a measurement of weight and how high you are, and we calculate BMI. And if BMI is more than 40, which is third degrees of obesity, so it's possible to think about surgical intervention and surgical treatment of obesity. So if BMI is less than 40, what we have to do? So second class of obesity with BMI from 35 and up till 40 also is possible for operation, but you have to have one of comorbidities, like second type of diabetes or osteoarthritis or some pains in your back. So in this situation, we'll be able to do bariatric procedure. Very often, in people asking us if BMI is below 35, what to do? It's is it any possibilities to do the operation? Sometimes if patient has some comorbidities, if patient gain weight all the time, it's possible to think about surgery, but have to be very, very, very special health problems for these patients. Usually not. And why I'm telling about that? Because usually girls in age 25, 30 want to reduce their weight, and they come for consultation with BMI below the 35, and of course I denied them, and if they do not have any other big problems. So there are some objective criteria when we can measure it and we can see if patients are suitable for operation. Of course, there are some exclusive criteria, and criteria for exclusion is severe mental problems. If patients suffering from mental disorders, it's not possible to do operation for those kind of patients. Also, if you have some addictions like alcohols or some narcotics addictions, also it's not suitable for bariatric operation. Also, kids, children under 18 years old, we are not doing this procedure for children. It's possible to do, have to be a very big BMI, but it have to be a very personalized decision with the kids and with the parents and with the other team to do the procedure. But generally, age under 18 is not suitable for operation. And also, upper grade of age is we are not doing operation routinely for patients who are more than 65 years old. And there are some relative exclusion criteria when from one point it's possible to do operation, but the operation can be very risky, in which cases it can be, for example, history of previous bowel operation, like bowel resection or some oncology resection. So in this situation, it's very necessary to know previous history, what kind of operation was done, and if it will be possible mechanically to do the procedure, bariatric procedure for these patients. So adhesions. And another criteria with this exclusion criterion, if patients suffering from other severe diseases like cirrhosis of hepatis, for example, or big degree of heart insufficiency. So in this condition, of course, the bariatric operation is contraindicated. So there are very complicated questions which we have to see from all the medical point of view. Before the patients come and we speak about medical possibilities to do the operation, of course, we are doing medical examinations. Some patients arrived in our hospital. We did examination before operation. It's chest X-ray, blood tests, fibrogastroscopy, and we find some abnormalities in this examination. And there were some cases when operation was cancelled because of necessity to treat other problems before, and after 3 or 4 months patients came back and have the procedure. So there is no just one simple questions. Yeah, we can do operation for patient A and we cannot do operation for patient B. So it's very complicated medical decision which have to be made with patient medical history, with patient's health condition, and with all examination which is necessary for operation. So it's from one point, it's easiest part think about, and from my point of view. And another part which I told you before, it's personal criteria, which I think it's a little bit more complicated and difficult, because this criteria is coming from you, like a patient, and you need to answer yourself on all many questions which have to be asked. And I put on a paper some questions which, from my point of view, is very important. And the first questions when I'm asking patients and ask them to ask themselves if they did everything to reduce weight without surgery. So why this question is, because some patient thinking, oh, surgery, it's very easy, nothing to do, I will just have surgery and everything will be okay. I would like to say that surgery is a very important step in your life. If you decide to do the surgery, it's a very important step. And you, before you're doing this step, you need to answer these questions and see on your lifestyle now before you make a decision to do operation. See on your physical activities, how active you are in your physical activities. See on your eating behavior, what you're eating, how often you're eating, how what kind of food you are eating. It's very, very important. Also, it's necessary to see on if you are on some medication, for example, for sugar control. Are you using them properly? Is this medication working on you? Is everything is okay with this medication? So there are very, very, very important questions which you have to ask yourself. Did I everything to reduce weight without surgery? I will take a little bit sips of water. Sorry. Another question is, which you have to ask yourself, are you ready and are you really want to change your lifestyle? Because maybe you feel comfortable and everything is okay and you don't need to do anything, and you need to think that your lifestyle after surgery will be changed completely to a different way how you are living now, and you will be unable to eat a big amount of food, a big amount of big portion. You will need to chew very carefully before you swallowing down the hummus. You change what you are eating and what kind of food you are eating, and also you need to change how often you are eating after surgery. So all these questions, it's very important for you to answer if you are ready and want to change your lifestyle. And also what you have to know about surgery is that surgery can be reversible. It's like in bypass procedure that we can switch everything back. Of course, it will be not so easy to do, and but it is possible, and surgery can be unreversible. For example, sleeve gastrectomy, it's unreversible procedure because big part of your stomach will be taken away from your body. So also these two questions you need to know about. So now I will try to describe for you what you have to know and how will be your life after surgery. So surgery take usually 1.5 hours approximately. So from 30-40 minutes to 1 hour 10 minutes, 1 hour 15 minutes, 1.5 hours. So, but 3-4 hours after surgery, you need you will be in a recovery room, and you will need to sit up, and you will be in vertical position, and you will start to move some legs, arms, and you need to make some big deep breaths few times. It's very important for movement after operation as early as possible to prevent some complications in the future. And 5-6 hours after, you will have some sips of water to drink. Yeah. What I'm telling about this condition, because you have to know all the steps after surgery, what you are expected to see. And first day after operation, you will be able to walk in the ward, and your job will be drinking clear fluids. Usually it's water. And clear fluids is for 4 days after operation, and from 5th day you will have some stuff to eat, like blended stuff or pureed food to eat. And after 10-14 days after operation, you can add some multivitamins in your food, or to take like supplements. About physical activities, 3-4 weeks after operation, you can start intensive walking and also swimming in the swimming pools. And 3 months after operation, you can go to the gym and start increase physical activities more and more. So how about later periods after operation? Following years after operation, you will reduce your weight, and this weight in the beginning coming quite rapidly down, and also you need to check your blood tests every 3-6 months in first year, and from second year you need to check once or twice in a year your blood results. So it's also very important changes in your life, because I know that a lot of people do not do blood tests every year or every half in a year, but you will have a rule to make blood tests and to see is there some changes in your blood. So it's life-changing situation. Yeah? You need to do this blood test. You need to visit your doctors, your family doctors, to see if everything is okay. Also, you need to go to physical activities like swimming pool or to the gym to be more mobile and more active. So what's another question what you have to know? It's you need to know about skin condition after operation. It's very important questions when people don't ask before the operation. I usually try to describe these conditions. After 1.5 years, your skin will be a little bit excessive, and you will probably need to see if you want to do other operation like plastic surgery. It's not necessary to think earlier, but after 1.5-2 years, maybe you will face probably you will face with this question. So you have to know it before operation. It's one of your also life-changing condition. So about physical activities, I told a lot, and what else I want to say is that if you do the surgery, you have to know that in the future after operation you will be not able to drink big amount of alcohols. It's also, from my opinion, quite important questions which have to patients to ask themselves. Why? Because when I spoke with big men who did operation, they can have a lot of alcohols, but after operation this doses is reduced. And it's quite important for you also to know that you cannot drink big amount of alcohols after operation. My opinion, not to drink at all, of course, but I know that people sometimes take alcohol, and it's quite important questions which you have to know before the operation. And another one questions is dumping syndrome, which also can be after operation. It's when indigest food is going down in your small bowel and quite fast, and you can have some discomfort, cramps, nausea, things like little bit pains in your stomach. It's possible to reduce with not eating so fast, with not eating very high caloric food, but also before you making a decision, it's like personal criteria for choosing operation. So I think that I give quite a lot of information about how to choose to do operation, and of course there are some benefits and a lot of benefits after operation. And the main benefits is that you will reduce your weight. Operation is successful if you reduce at least 50% of excess weight. It's quite big amount, but as I told you previously, that you need to change your lifestyle, you need to change your physical activities to reach more. Some patients can reach 80, 85% of excess weight loss, and it's very good result. Why? Because they are also changed their lifestyle a lot. Yeah. What another benefits? It's if you're suffering from type 2 diabetes, it's have a very great effect on glycemia control after bariatric procedure. So it up till 80% reduction of and you have remission of type 2 diabetes. Very, very important. Also, from my point of view, it's very important questions. It's reducing the weight. You will have ability to walk. So with the big weights, physical activities is very difficult to keep on going all the time. And when you reduce your weight, when you have operation, you get very good ability to have physical activities. Another very important point, it's ability to sleep. I know that sleeping apnea suffering a lot of these patients, and ability to sleep, it's also very important questions, very important benefits after bariatric operation. Of course, there are some benefits when you are on blood pressure medication. After operation, you reduce these doses of blood pressure medication, which is very good. You need less medication for achieve better result. Other benefits is normalize hormonal level, which is also very important. And for young ladies, it's very important to have normal hormonal levels. Also, it's improve in fertility. And another one benefits, it's reducing the weight. You have less pains in your back, less pains in your joints. So this is briefly what I wanted to describe for you. And then I usually try to inform patients before operation about necessity to think about all these questions together, and decision to do operation, it's very complex decision from surgical point of view. Ylva, any questions?
Yes. Thank you. You managed to tell more than I was expecting today, but okay, these all are very important questions for people considering the surgery. So you really have to think about all those aspects of the surgery, about your lifestyle change, about physical activity, about your relationship with food, your emotional things, why, yeah, to consider all your triggers, all your things, why you are at this condition. Where you are. So thank you to the doctor. I can't see. Yeah, hello. I can see those, but I can't see any questions from you. So I think we can say thank you to the doctor for today. We will think about another topic to speak about again, and have a nice Friday and nice weekend. And thank you, and see you another time then. Okay.
Yes, thank you. Have a good day. Bye bye.
Bye bye.